Welcome back to another episode of your fitness consult. I am Dr. Mayer. I'm not coming to you from the gym like I usually do. I haven't been to the gym in a few days. I injured myself the last time I was at my gym. I'll tell you all about that in a little bit, but I did want to tell you first about a creepy gym story that happened to me about last week or the week before. So, I work nights. So on my nights off, I go to the gym around midnight. And it was around, I don't know, 1:15, 1:30 a.m. I was by myself at the gym, like I usually am. No one really comes in around that time. Usually maybe when I get there at midnight, maybe someone's finishing up, but no one ever really comes in the middle of the night. I usually have the place to myself. So it's a warehouse gym. And so you can see like the garage doors that come down. You can see the little windows into the outside, which is pitch black. And I saw what looked like a double headlamp, which I've never seen before, but I can see it through the windows and it's starting to freak me out. If I was not in my right frame of mind, I would have thought it was an alien because it looked weird and it was like moving around. And I was like, what is that? And I did see a car pull up right before that. So I was like, someone I thought was coming to the gym and then got out of their car and then had this weird double headlamp on it. It just kept moving back and forth across all of the windows of the garage, like it was pacing the building. So I started getting really scared. My wife happened to call me right around that time. And I was like, hey, stay on the phone with me. Something weird's going on. And she was like, maybe it's a car's headlights. And I'm like, it's not a car's headlights. Like, I saw a car pull in. I saw something with two lights come out and now it's pacing back and forth. So I'm freaking out. And she's on the phone with me, and I'm like, okay, let me calm down. And then a guy comes into the gym and he's like tatted up. I've never seen him before. He doesn't look like he's really in gym clothes, but he has a water bottle with him. I was like, okay, maybe this is double headlamp guy. I don't know. I didn't see any headlamp on this guy. But I said to my wife, I'm like, okay, somebody's in here. They look like they're like ready to work out. I'm good. Like I've explained what I've seen. I can get off the phone. So I'm all the way in the back of the gym. It's a small gym. He goes first to the front for like 30 seconds. And I was like, great, you stay to your side, I'll stay to my side. And then all of a sudden, he comes all the way to the back of the gym, which again isn't that big, but he passes up like 5 benches to take the bench right next to the squat rack that I'm at. And I was like, hold on. Like, you could have benched at any of these other benches. Why did you have to pick the one right next to where I was? Totally creeped me out. So my wife actually happened to call back to make sure I was okay. And I was like, not okay again, because this seems pretty creepy, like I nodded to the guy, he nodded to me. And I was like, even if this is like your favorite bench, everyone knows you don't go to the machine or the area right next to somebody else when you're the only two in the gym, especially at 1:30 in the morning, especially when I'm a female. I think a lot of the men in my life, in all of our lives, would know better than that to like creep out the woman that's in the gym or even the strange person. Like, not to approach that person. So my my wife was like, get out of there. I was like, yeah, I'm gonna do that. So I packed up my stuff and I went to go leave. And as I'm approaching the door to leave, I see double headlamp again outside. And I was like, what is happening? I'm like, I can't stay in here because this guy is creeping me out. I don't want to go out there because there's double headlamp dudes out there. But I was like, I'm gonna go out. Like, I just need to get to my car. And I go out and there was this guy wearing a double headlamp and he's just pacing back and forth. He was trying to make a delivery, I think, to the place next door. He had this big truck with that can hold like 8 cars, and there was like 2 cars on them. And the place next door is like a Volvo. I don't know, they sell Volvos. They're not a dealership, but they sell Volvos. And I was like, maybe he's trying to make a delivery of a car, pick up a car. But it was like 1:30 in the morning. I don't know. The whole thing creeped me out. And it looked like he was kind of like gonna come to me, but I got into my car and I got the hell out of there. So that is my creepy gym story. But like, I'm right. right? Like you don't go next to the person, like right next to where they are if you're the only two people in the gym. Like that's weird, right? Especially if one of you is a female and one of you is a male. I don't know. I still think there was something off with that dude that was in the gym. That's why I took my chances outside of the gym. So, all right, let's move on. So, I injured myself. Oh, it is disheartening. For those of you out there that have injured yourself, I know you can feel this and you understand because I was just saying to myself the other day, I was just walking around and I was like, man, I feel invincible. I feel capable of anything. And then this happens. It's like, what a way for the world to humble you. It was like the other day at work when there was a guy, an 80-year-old, who was having chest pain, and I work nights, so I had to go see him in the middle of the night, and I go to see him, and I introduced myself. I said, "Hi, I'm Dr. O'Brien," and he looks at me and he goes, "So?" And I started laughing because I'm like, "Touche, sir." Thanks for humbling me. I was having a good day until this interaction. So that's how I felt when I hurt myself at the gym the other night. I've done a couple of powerlifting meets. I'm really into powerlifting. All of my strength training for the last year and a half has been either the on season or off season of powerlifting. And I consider that an accomplishment. I'm 44 years old. I didn't start strength training at all until I was in my 40s, never mind powerlifting. And, I don't do well at these competitions, but I do it for fun and I do it to prove to myself that I can. And I've been in my head about my deadlifts recently. And so my coach had me switching to snatch deadlifts for this block to kind of get a mental break from conventional deadlifts. And to kind of build up my upper back for when I go back to regular deadlifts. So I was doing snatch deadlifts, and you do snatch deadlifts at like way less weight than you would do a regular deadlift. And so that's what I was doing. It was not a lot of weight. It was 75 kilograms. I kept the weight even lower than I felt like I could do because I really wanted to focus on technique. And I took last week off from working out because I was on vacation, which I haven't done, I don't know, ever in a long time. So I didn't want to like tax my body because I already took a week off. I did a set of 6. Great. My next set on the second rep, as I'm pulling the bar up, oh my God, I felt a snap. I felt a snap in my left lower back, and I immediately put the bar down, and I couldn't move. It brought me to my knees, and I was like, oh no, what the hell was that? And I'm alone in the gym. It's like another day where it's like 1:30 a.m. and I couldn't get up. I was down. I was on my knees. I was in so much pain. And I was trying to take deep breaths and I'm like, this isn't good. What the hell snapped in my back? So I was able to get up and then I was trying to, walk it off and kind of assess the damage. But I couldn't bend. I couldn't bend after, like I couldn't do the hip hinge that you do with a deadlift. I could barely walk. And I couldn't even unrack the barbell. I left a note for the owner. It's a small gym, so I know the owner. And I was like, dude, I'm sorry. Like, I hurt myself. They could run the videotape. They record video at night. So I was like, you could laugh at me and watch, but I hurt myself, and I'm sorry I couldn't re-rack the barbell. And I had to like take very slow steps to even bring my bag back to my car. And then to get in my car, it was bad. I got home and I wanted to cry. My wife had to help me take my socks off. It was really bad, really bad. Especially at my age. I mean, I'm relatively young, but I'm also kind of old. I'm 44 years old. So, and it made me rethink kind of, what does this mean for deadlifts? What does this mean for powerlifting? What does this mean for me moving forward? What did I do to my back? What the hell happened? So I went to bed. I did the things you're supposed to do, I put ice on it immediately. I took anti-inflammatories and went to bed and woke up the next day, and it was a little better, but definitely was still, my back was crying whenever I tried to bend. I'm now 2 days out and it's actually feeling a lot better. It's still there, it still hurts all the time, but I can bend a lot more. I don't have full range of motion, but I can bend a lot more, and I don't feel so dire about what this means for my future in powerlifting and deadlifting. I think I'll be able to get back to it at some point. But you know, when we're injured, especially when we're on this journey and we're so used to just pushing and pushing and pushing, it's really hard to pause. It's really hard to pause and not be the person that goes to the gym all the time. I broke my foot last summer around this same time, and that humbled the crap out of me because I was even more go, 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 and maybe not having that healthy of a relationship with my workouts as I do now then. And that really knocked me on my ass, especially because I was just starting to train for a powerlifting meet, my first one. And so it really knocked me on my ass. But I think I have a healthier approach this time to my injury. I'm not going to work out for the rest of this week. I'm not going to work out next week. And then I think I'll probably be able to start back at the gym. Definitely going to be a little bit till I can deadlift, or deadlift at my max. You know, the hip hinge movement is going to be important in rehabbing my back, but definitely won't be getting back to maximum, deadlifting. Maybe not for a month or two, probably 2 months is my guess. But I did want to talk about kind of the mindset of injuries and how to pause and how to be okay with that. I think one of our first instincts is that, oh man, we're going to lose all of our progress. And I can tell you from me breaking my foot last summer that you don't lose all of your progress. You lose some movement patterns is what you lose. But there are a lot of other movement patterns that you can do depending on how you injured yourself. So the hip hinge for me is going to be difficult right now. But I can do a lot of upper body stuff. Squatting doesn't hurt. I'm not saying I'm going to load any of this stuff up because I don't want to put that strain on my back, but I can still do the movement patterns. And so it's important to focus on the things that you can do, and you can find a lot of things that you can do and focus on. And maybe now's the time to, be uber focused on something that you had in mind but didn't seem that important. So for example, if I want my bicep curl, I can do maybe reps of 10 with 20 pounds. Maybe now's the time I focus on trying to improve that, or a shoulder press or something like that. I'm doing nothing right now because this just happened 2 days ago, but I'm going to find the things that I can still do. The other thing to note is that not only will you not lose strength from that standpoint, but you won't lose any of your progress with your nutrition, because that is also something you can focus on right now. We all know that the fat gain or fat loss that we experience is very much more related to our nutrition than it is to what we do in the gym. And so I can, I'm on a deficit, so I can really focus on the deficit. And I found already that the deficit is actually a little easier when I'm not pushing myself so hard in the gym, because my body doesn't demand as much. And so I don't have to give it as much, and I don't then have as much hunger because of that. So I'm going to dial in my deficit. I'm going to rest initially for the rest of this week and next week, and then start to find the movement patterns that my body will allow me to do while I rehab that hip hinge movement and rehab my lower back. In terms of what to do in the acute phase from a medical standpoint, let's talk about that, because I get that question all the time. Ice, heat, what do you do? So initially when you have the injury, so for me, it was my left lower back. I felt something snap. And when that happens, capillaries open up, all the inflammatory particles rush to that area to start with the repair. And so that's where the swelling comes from. And so while that is a good process for your body, that can definitely cause a lot of pain and discomfort. And so in the acute phase, you'll want to ice, not heat. Heat will actually open up those blood vessels more and get more of the particles, the inflammatory particles there. Ice, cold, will constrict those blood vessels. And so it will stop or decrease the inflammation because of that. Ice is also numbing. It numbs the pain receptors, so it will help with pain control as well. If you are medically safe to do so, if you're able to, anti-inflammatories would be another thing that you could do. That's something that you would need to make sure is okay through your healthcare provider, but anti-inflammatories around the clock for 72 hours would also be the thing that you should do. In terms of movement, you don't want to make the pain worse. You don't want to aggravate the pain, but you shouldn't completely rest. Resting is actually one of the worst things that you could do. You want to find that balance. So in terms of my back being hurt, I'm not going to go running like I've been running. I'm not going to go get my 15,000 steps like I've been getting, but I am going to, and I have been going for small walks. And so I am resting it in that I'm not exerting myself the way that I used to, but I'm also letting myself get movement in. So if you have to find that balance. If you just go on complete rest, it's just going to make the situation worse. You do want to get, to some extent, some blood flow to the area. You do want to not let the area get stiff. And so the earlier you can actually bring some movement to the area, the better. And so I just switched today after about 48 hours to heat because the swelling was decreased. And so once the swelling is decreased, heat, as I mentioned, will actually bring more blood flow to the area, and that is what you want. And you want to then start with a little more movement as the pain gets better. Test it out. You know, I've been doing my bending over, trying to see how far I can bend down. And a little pain is fine. You don't have to stop once you get a little twinge of pain, but you don't want it to be so bad that you're yelling out in pain. And so you want to test it out and then just go for little stretches like that. And then, you know, as your body allows, go into more mobility, more stretching, more movement. But that's something that you can definitely talk to your healthcare provider, talk to a coach or trainer about, physical therapist. But in the acute phase, it would be ice for the first 24 to 72 hours, depending on the swelling. Anti-inflammatories, if it's medically safe to do so, around the clock for 72 hours. And then make sure you get some movement to the area. So when this first happened, I'm a doctor, so I was trying to figure out exactly what I did. What snapped in my back? So I was going through the possibilities. You know, did I herniate a disc? Was there a muscle that was torn, strained? Was it a ligament? Was it a facet that irritated? The facets are in your vertebral spine. The facets are little bony projections that they kind of fit from one vertebrae lower to another vertebrae upper part, and they kind of form the stability of the spine by forming those little connections between the vertebrae. And so those were all possibilities. You know, what did I do? And so I'm running through my head of like, okay, let me go through certain tests to see, you know, if you cough, sneeze, bear down, and it doesn't worsen the pain, it's probably not a disc herniation. I didn't have any pain or radiating down my legs, you know, numbness, tingling. I didn't have any of that. I had a weird sensation on my medial thigh, and I was like, could that be compressed nerves? It could be, not necessarily a herniated disc. But, you know, I'm running through like all the things. I'm running myself through physical exam tests. And, you know, it occurred to me that I'm doing that because that's my way of coping, because I'm a physician. And it's easier for me to focus on that than the fact that maybe I won't be able to deadlift again. This is this first happened, and I was in such severe pain. But when it comes to pains like this, medically speaking, it actually doesn't matter, at least initially, what it is, because the treatment is the same. It's the anti-inflammatories, it's the icing, it's the physical therapy, the movement, the mobility. And it's only if that doesn't work over a certain period of time, then we really try to tease it out. Or if it's super obvious, like if I had sharp shooting pains down my legs, I would know that was a herniated disc. But again, treatment would still be the same, at least initially. And so while it was a mental exercise that occupied my mind, it really didn't matter. And that got me thinking about kind of everything on our fitness journey, because all of us found ourselves overweight for different reasons. Some of us had a depression, some of us from anxiety, some of us from childhood trauma, some of us because of our biology, and we just have a stronger hunger drive. It doesn't have to necessarily be related to a mental health disorder or anything like that. It's very important to understand your relationship with food, and ultimately you will want to work through that. But in the initial phase, it actually doesn't even matter, because we all have to do the same things to jumpstart the weight loss, to jumpstart the fat loss. It would be tracking your macros, tracking calories, making sure you're hitting a certain amount of protein, weighing your food, making sure you're weighing it properly, making sure you're getting your proper movement in, proper cardio, all of that. It's the same steps, taking your progress pictures, measurements, all of that kind of stuff. It's all the same, no matter what the initial cause is for us to have a bad relationship with food. And it's going to take going through those motions without even understanding where your poor relationship with food came from to get the fat loss that you want to get. For anything to be sustainable, though, I do think it is important to kind of work through those issues, but that's not something for the acute phase. So much in the same way as for my back, it doesn't actually matter what I did in the acute phase. Over time, for me to know how long I have to stop deadlifting and, when I can get back to powerlifting, if at all, it will be important to know for me if I herniated a disc or not, given my age. And just like with a fitness journey, how did I get to be 80 pounds overweight for many years? That's something that I didn't have figured out when I started tracking my calories and entering stuff into my fitness pal and getting a coach and figuring all that stuff out. And it didn't matter in that acute phase, but ultimately over time, you will have the bandwidth to figure that out. And that is something that's really important to figure out. And that might involve a therapist. You might be able to figure it out with your coach. You might be able to figure out on your own, but it doesn't matter initially. And so if you find yourself stuck in that negative self-talk, that self-pity of like, how the hell did I get myself here in the first place? I've been there. Believe me, I've been there in that cycle, and you can get stuck in that of how the hell did I get myself, let myself get here in the first place. But don't let that stop you from just jumping into the steps that you need to do in that acute phase to start that weight loss journey. There's one more topic I wanted to talk about on this podcast. And it's the concept of a differential diagnosis. And so, as I mentioned when I hurt my back, I'm running through the differential diagnosis. It is the possibilities of what could be going on. And so I hurt my back, and my differential diagnosis was, herniated disc, facet irritation, muscle strain, ligament strain. You think about all of the possibilities that could be causing what's going on. And then I run through the tests to kind of rule things in or rule things out. And it gives a framework, and we use it in medicine all the time. Someone comes in with chest pain, and we were taught this in school from the very beginning. Someone comes in with chest pain. What's your differential diagnosis for that? What are the possibilities? There's so many for chest pain, by the way. It could be musculoskeletal. It could be an irritation of the muscles, our rib muscles. It could be a GI issue. It could really be heartburn that's causing me to have pains in my chest. It could be a cardiac issue. It could actually be my heart. It could be a skin issue or an infection such as shingles that I just don't see the spots yet, because it's, sometimes you do get pain a few days before the lesions pop up. And so chest pain can be from a number of different things. So you want to form a framework on how to figure it out. So you form your differential diagnosis, and then you take each branch off of that tree, and then you break that down even further. So if someone comes in with chest pain and I'm worried about it's their heart, I get an EKG, I draw blood work, I put them on the heart monitor, things like that. If I'm concerned that it could be a GI process, I press on their belly. Is it actually coming from their belly? I run the labs that would take me there. I can get an ultrasound of the gallbladder, make sure it's not the gallbladder that's causing referred pain to the chest. So you run down each kind of branch. Musculoskeletal, if I press in one particular spot and you're like, that's the pain, then that's probably what we call costochondritis, or inflammation of the rib muscles. And so it's a way that even if you don't know the answer, you take a problem and you think of the possibilities, and you can write that down. Write down what your problem is and literally draw branches coming from it. What are the different possibilities? And now that I have these 4 or 5 possibilities, then I draw my branches even more. What can I do to test these out, to narrow it down even more? And you ultimately narrow down, and can get pretty close to a good diagnosis of what's going on, or at least you ruled out kind of a bunch of major stuff. And so yes, I was doing that the other day with my back, but it's something you can do every day, no matter what. You can do it in low risk situations. Like, why can't I keep my desk uncluttered? And it's like, well, I have a habit of coming home from work and just whatever I have, putting it on my desk and then not doing anything with it. Or it's because I don't have any other place for the stuff that I usually come home from work with, so it ends up on my desk. Or I don't devote enough time to go decluttering my desk. If I just devoted 10 minutes every week to doing it, I wouldn't have a cluttered desk. So you draw these branches and you're like, well, what could it be? It could be more than one, but it kind of helps form a framework. But you can do this for big things in life. If you are finding that you're not saving as much money as you need to or you want to, you can definitely run down that list. Why am I not saving? Why is my savings account not where I want it to be? So for that one, it could be, am I not bringing in enough money given my expenses? Or am I spending more money than I want to save? And if it's that one, you go through the ladder and you go, well, am I subscribed to things that I don't even keep track of that's causing more money to come out of my account than I even realize? And then you go down that branch. How can I figure that out? Okay, let me look at my credit card statement, my bank account statement. Let me see what is actually coming out of my accounts. So you form this differential diagnosis, and then you form these branches, and you keep going down the branches until you can figure out exactly what's going on. So it's just a great framework for what I do in the hospital at my job, and in trying to diagnose patients. But I think it's also a great framework in life. So I'm probably going to reference that a ton in future episodes, like let's form the differential diagnosis for these problems that's going on. So I just wanted to introduce that concept to you guys. That's all I have for this episode. I just finished up a night shift, so I'm going to go home and get some sleep. Make sure you follow me on Instagram. It is Dr. Mare at Your Fitness Consult. I post some content there. You can message me, ask me any questions you want for the podcast, and I'll see you next episode. Bye. Thank you for watching or listening to the podcast. This podcast is not meant to be medical advice. I'm a physician, but I'm not your physician. And this is not a binding physician-patient relationship. All of this is for informational purposes only. Please don't use this content to substitute for your own medical provider's advice. Please go talk to your medical providers about all the questions that you have, and please listen to their advice. If there's an urgent situation you find yourself in, please call 911, go to the nearest emergency department, and just know that medical knowledge always evolves. So while this may be current knowledge at the time, whenever you're listening or watching this, that knowledge may have evolved. Talk to you soon.